Good afternoon and welcome to Let's Chat with Dr. Celeste, MD. I'm your host, Dr. Celeste Reese-Willis. I am your board-certified family medicine physician specializing in urgent care. I assist busy professionals to find solutions for both their acute and chronic medical needs. I do this via my concierge medicine program, telemedicine program, direct primary care, as well as COVID testing and the administration of COVID vaccines, in addition to my Amazon best-selling book, Vitality. Good afternoon, ladies and gentlemen. Welcome to Let's Chat. Today's topic is testicular cancer. As many of you may know, April is Testicular Cancer Awareness Month. So what we try to do each month is highlight topics that may be beneficial for you, particularly highlighting awareness and the idea of prevention. So this month's cancer topic that we chose was testicular cancer. Now, what is testicular cancer? It's the most common cancer that's diagnosed in men ages 15 to 35 years old. It's also one of the most treatable forms of cancer, even when it's spread to other areas. The American Cancer Society rates that testicular cancer that's found in early stages has a 95% 5-year survival rate. We'll talk about that at the end as to what that means, but that's primarily the reason for the Facebook Live today. Testicular cancers come generally in the form of germ cell tumors. They account for greater than 90% of testicular cancers. There are two forms of those. There's seminomas, which are testicular cancers that are slow growing in nature. Typically, they're confined to the testes. You can get lymph node involvement, but particularly they tend to stay in the testicular area. Non-seminomas are the most common form of testicular cancer that is fast growing. It can spread to other parts of your body. Testicular cancer is a cancer that originates in one or both testes. And so let's talk about what testes are. The testes are the male reproductive glands that are located in the scrotum, which is the sac or pouch of skin that's located near the base of the penis. The testes are responsible for producing sperm as well as the hormone testosterone. Cells in the testes are called germ cells that produce sperm. Testicular cancer most often begins with changes in these cells. That's why we explain what those are. Now, let's talk about some of the risk factors for testicular cancer. Number one risk factor is having family history of testicular cancer, okay? So family history of testicular cancer is a risk factor for testicular cancer. Having abnormal testicle development, being of Caucasian descent, as well as having an undescended testicle, which is called cryptorchidism. And those four things are risk factors. Again, family history of testicular cancer, abnormal testicle development, having an undescended testes that doesn't drop in the testicle sac or scrotal area, as well as being of Caucasian descent. Symptoms of testicular cancer include pain in the testicle area or discomfort. You can have testicular swelling. You can also get lower back pain or lower abdominal pain. In addition to that, you can get enlargement of breast tissue, and inevitably, we know that that is hormonally related. So, if someone is having, if you're at risk for it, or you notice that you have swelling in your testicle area, or if there are ladies listening, the reason why this is beneficial for you as well, we both know that sometimes men, aren't the first to run to the doctor to find out what's going on. So if it's something that you notice, even this is information that can be beneficial. And so if you're having swelling in your testicle area, that is something that as a man, you want to make sure that you get that checked out as soon as possible, specifically if you're in this age range. A lot of times when we're dealing with patients that are younger, they tend to think, oh, this couldn't happen to me, but this is a cancer that's found. And remember this, guys, in people that are 15 years old to 35 years old, which is very, very young. And the older I get, the younger that gets. But 15 to 35 is very, very young. So we want to make sure that we pay attention to these things. So if you're a mom out there and you have a son and you have noticed or he complains about any of these things, definitely get him seen by his physician. The diagnosis is made after physical exam. You typically have an ultrasound of the testicle as well as blood tests that check for certain hormonal and tumor marker tests is what we call them. In addition to that, you could have CAT scans that we utilize to stage the cancer per se. Forms of treatment include surgery, radiation, and chemotherapy. That is a decision that will be made once you've had that consult with your physician and the oncologist. Now, we definitely want to make sure that we, acknowledge and recognize that this is a form of cancer. We already talked about it, that it has a 5-year survival rate of 95% if it's caught in the early stages. So that's what we want to hang our hat on, is being able to catch it in the early stages, which pushes the idea of prevention, which is brought about when we bring more awareness to a particular area so that more people know, hey, this is something to watch out for. Hey, this is something that I may need to get checked out, so that if you have a son or a nephew or a grandson or a husband who comes in and has some swelling and pain in his testicle area, and it's a large amount of swelling, most men will probably seek medical treatment, but we want to make sure for those men that may be a little more hesitant to, that we go ahead and encourage them to get that checked out. Again, 95% survival rate at 5 years. So what that means is, for, let's say you look at 100 people that have been diagnosed with testicular cancer in the early stages, that means that from the point of diagnosis, 5 years later, 95% of those people are still living and viable. So that is an excellent survival rate. And one of the things we can do to help keep it that way is to make sure that we continue to promote prevention and awareness. One question I know that I received before about this, and that is whether or not, if you're a male that has testicular cancer, does it affect or can it affect your fertility? And absolutely it can. So this is another reason why we want to make sure that if we are having symptoms of this nature, we get it checked out as soon as possible. The earlier it's found, the better, typically for most situations. But yes, if one or both of your testicles are removed, it can affect your fertility. However, there are certain technological advancements that have been made that can help to protect fertility in certain situations. That is a personal consultation with your physician, as well as oncologist, fertility specialist, etc. But the main thing there is that making sure that we're aware and that we catch it sooner rather than on the later end, to protect our fertility with that as well. So that's the only topic that we have for you guys today. I hope that that was informational for you. If this information is helpful for you, please pass this information on or share it with other individuals. If you are having some of these symptoms yourself, definitely please go see your physician right away and be evaluated. We are seeing patients in primary care. We will restart seeing patients in primary care next month. We are currently continuing to do COVID testing at Legion Field, but in addition to that, we've been able to partner with Bruno Event Team, Department of Health, as well as the airport, Birmingham International Airport, to provide vaccines to the community at the airport. So if you have not yet received your COVID-19 vaccine and you want to get a vaccine, please give us a call so that you can get an appointment and or go to the link. The link will be on our webpage on Facebook, that you can go there and schedule an appointment. We generally get every patient in and out, including the observation time of 15 minutes, in about 30 minutes. We've been able to get the process down to that point. But we've got an amazing team of people that help to make that happen. So we're happy to be able to provide that to the citizens of the community. If you're in need of COVID testing, we are continuing to test at Legion Field. If you are in need of primary care, you can contact us for that as well. In addition to that, guys, just one thing. Each Monday, just to give a little pep here, each Monday, I'm partnering with CBS 42 News here in Birmingham to provide a segment that's called House Calls. And what we try to do is answer all of your medical questions. So if you have medical questions at all in any area that you would like us to answer, please email us with those questions to housecalls@cbs42.com. This week's topic that we'll be talking about tomorrow is your vaccine checklist, your COVID-19 vaccine checklist. So if you have any questions, leave those questions here and or email those to us. You also can inbox me with those questions as well. But we'd like you to email them to us at housecalls@cbs42.com. So that's all we had to share today. Short and sweet. It's a beautiful day here in Birmingham, Alabama. Go outside, get your vitamin D. Definitely put on that sunscreen first. Mask up, especially if you're going to be around other people and they are not vaccinated. Okay? So that's all we had to share. Does anyone have any questions? Any questions about anything? Any questions at all? I know we've said a lot today. Any questions about testicular cancer? It's concerning because of the age group, and a lot of people are amazed at the fact that there are young men that young that have cancer, but it does happen. But again, we have that 95% 5-year survival rate when it's found in early stages, which is why bringing awareness to the topic is so important. No questions. Okay, not seeing any questions. Hope that you guys have a happy Sunday. If you have questions, again, any medical questions at all, please email those to us at housecalls@cbs42.com. I am your favorite board-certified family medicine urgent care physician, Dr. Celeste. You can reach us again at drcelestemd.com for all of our services. That's DOCTORCELESTEMD.com. Thanks so much, guys. Thank you for tuning in. We appreciate it that you guys take the time out to tune in every Sunday. Okay? Have a good day. Bye-bye.